this is me Gayatri Prakash and welcome to my page. Ellavarkkum ende page lotte swagatham. So today I would like to discuss with you all about 6th of August 2022 OET exam. So almost the exam was quite okay except the listening, because my students just given me the feedback about the exam and they said to me that listening part A was quite tough and part B and C was okay. And regarding the reading was okay, they got adequate time to complete the task and everything. And the writing, it was a so simple transfer letter as usual to the nursing home, and the letter is written by a community nurse who is doing a home visit. And regarding the speaking topic, it's bit familiar topics, but it is quite rarely to ask. So this is like nightmare, which is very new to us, like the nightmare and superficial burn management. And another thing is like heparin self-administration. Last time they have asked insulin self-administration, so this time it's a heparin self-administration. And another thing is that it's a bedwetting and asthma. So these all are the topics. So some of the topics are very familiar to us, and two topics like bedwetting and the nightmares, they have asked quite a few months ago. So it's quite it's somewhat familiar, also it's somewhat unfamiliar. Anyhow, just move on to the discussion. Okay, so now I'm going to discuss with you all about the OET writing. So what was the letter and to whom we are writing this letter? Okay, so this letter is writing to a nursing home manager for the long-term nursing care. So what is the long-term nursing care? So long-term nursing care, which means the patient will stay until they die. So they need 24 hours nursing care until they die. Okay, and here the letter is written by a community nurse who is doing a home visit as per the patient's GP's request. So there are 3 home visits were there, and what happened and what is the patient case note. So let's move on to it. Patient name is, they said to me, like Antonia Jose. So I'm not quite sure about the name this time also. It's a female patient, so her first name was Antonia and the second name I'm not sure, they said it like as a Jose. And they did not give a age of the patient, they have given a date of birth. It was 1939, so you can calculate that what could be the age of the patient. And she is a widow, and she is a retired gardener. Though she has a daughter, though she has one daughter, she lives alone because the daughter is not in a situation to take care of her mother. Okay. Regarding her past medical history, she has had migraine for almost 20 years and she is on treatment for that. But for the last 1 year, the frequency of the migraine has got decreased. So she is on PRN medications for the same. And the second condition is, her main condition is Parkinson disease. She was diagnosed with Parkinson on 2021, June 11th. And since then, her condition got deteriorated and then she ended up with depression and she had a fall at last. Okay. And the second condition is, like the third condition is, she is a breast cancer patient. She had a lumpectomy quite long years ago, and also she had radiotherapy, and she is on remission period. So now on to the present medical history. So what happened to the patient? 31st of December 2021, patient had a fall while she was gardening in her house. Okay, so after that, as per the GP's request, the community nurse was playing a home visit role. So she is doing twice a week home visit. So almost 3 visits, and the last visit happened on 8th of Jan 2022. Because as I mentioned you already in my previous videos also, nowadays they are giving the today's date in the letter is almost the January dates. Like today's letter also, they have given the date was like today's date. In that column they have given 8th of January 2022. So which means that was the last visit which was done by a community nurse. Okay. So since then the community nurse has been doing a home visit for the patient to clean the wound, and patient was having kind of a laceration and bruishiness over the right and left hand and the legs all over the place. extremities, so that the nurse gone to the home and to do the dressing, and she found that the patient has no infection And but what happened, which means mentally patient was not stable. Patient was quite weak and kind of having mood swings. And the second visit also she gone, patient was so frail. Frail, which means F-R-A-I-L, frail, which means it's another word of weakness. So thereby she was discussed with the family members as well as GP, patient GP. So they have agreed for the placement of nursing home. So the patient will be transferred to the nursing home after 10 days. Okay. Her main hobby is gardening. She loves gardening like anything. So she is okay for the transfer, and she said, okay, I am ready to go to the nursing home. I will stay there permanently. I don't mind it, but I still have to have a chance to access with my gardening. So that was her main plan. So they have to accept it. So thereby a community nurse going to write a letter to the nursing home manager 10 days prior to the patient placement over there. So this is about the case note of the patient. Okay. So now how we can write a letter here? As usual, date on the top of the paper. So which day we used to write it? Which day we are writing the letter, which means today's date. So today's date we are going to write a letter. So today's date in the letter they have given us 8th of January 2022. So that is the date we have to write it on the top of the paper. Either we can write address first nor date first. So choice is ours. So there is no difference, much difference in that. And after written the address, as usual, reference. In the reference we are writing the patient full name and the date of birth given, which means you are writing a date of birth, or else we are writing an age. Coming to the point of an introduction. So to make an introduction, we need three things mainly. One is purpose, patient name, full name, as usual, patient condition. So what is the purpose here? Patient need a permanent nursing care, isn't it? So that is the main thing. We are writing this letter to a nursing home manager. So patient needs a complete 24 hours nursing care permanently, isn't it? So patient, what is the main diagnosis of the patient? The main diagnosis of the patient is Parkinson disease. So here we are making the introduction like this. This is to introduce, like that also you can write. I'm writing to introduce also you can write. I'm writing to transfer also you can write, because it's a transfer letter. She will be transferred after 10 days, 18th of January 2022. So the choice is yours, which way you want to write it, or else I don't want to start with any kind of the like what to say, the format. I just want to start with the simple by patient name. So that's also fine. So patient name is Antonia, but I'm not quite sure with the full name. So for example, Miss Antonia Joss, Mrs. or Miss Antonia Joss, and who has been suffering from, or who has been diagnosed with the Parkinson disease. Okay, so we can write it. And then what is the purpose? We have to write it, which means she needs a full-term nursing care at your service. So she need a full-term nursing care at your service is very important. And coming to the present medical history paragraph. So present medical history paragraph, we are starting from the patient condition. So patient had fall. So we are writing her second name, Miss Joes had a fall on 31st of December. Since then she has been under my home visit for the wound dressing as per her GP's request. And then thereby during my first home visit, she was noticed to have weakness and tiredness, like that we are just writing it. After that her wound was assessed, there was no signs of infection and it was cleaned and dressed. During the second home visit, she was frail and her wound was cleaned and dressed and it is healing well. Thereby the nurse, which means we are the one writing the letter, so we are just speaking. So thereby her condition was discussed with the family members as well as her GP. As per their request and with the patient consents, the patient will be transferred to your facility on 18th of January 2022. This is more than enough for you to write it in the present medical history paragraph. Coming to the point of social background. Social background, you are writing about what? Her second name Joes, for example, Miss Joes is a widow, and Miss Joes is a widow and she is a retired gardener, full stop. Her main hobby is gardening, and she enjoys gardening, she loves gardening, like that. In which way if you want, you can write it over there. Though she has only one daughter, she is still living alone. That's it. And regarding her past medical history, she has had a depression. She has had depression for the last few months, for 5 to 6 months, because they have diagnosed her with the Parkinson disease in the year of 2021 June 11th. So after the next month itself that she just developed with the depressions and mood swings. So you can mention it over there. She has had a depression, like you can write she has after this one. So following a Parkinson disease, isn't it? So like that you can write it. And then what else she had, as I said, like she is having the migraine, and the frequency of the migraine got decreased since last year. So since last year, so she is on PRN medications for the same. And also you can write she had a breast cancer, and that she had a breast cancer, consequently she had a lumpectomy and a radiation therapy, and she is on remission period. Okay, and these are the past medical history and social background. Coming to the point of discharge advice, so not a discharge advice, it's a transfer advice. What the advice that we need to tell them to follow up for the patient. So here the first main thing is they have to continue the wound dressing, especially until the wound get healed. And second thing is we are just telling them to continue the medications, as she is taking medications for the depressions, as well as she is taking the medication for the migraine PRN medication. Because they have given the name of the medications, but I'm not sure with the medication, because my students were not much, they were not remembering of the name of the medication. So that's why I couldn't say. So I'm just saying that there are medications for the depressions, and then that was very recently increased dosage of the medication as due to her mood swings. So the migraine medication, she was on regular medication, that has changed to PRN because the frequency of the migraine gone down. That's why. So we have to advise them to continue the medications for her, and then they have to just second advices we are advising them to. So it would be highly appreciated if you could continue the medication as well as wound dressing for her, first one. And second point is like she needs a physiotherapy, that they have given as a question mark before the physiotherapy. So what we have to say, like if it is possible, kindly arrange a physiotherapy program to improve her mobility, because being a Parkinson patient, she is having tremors. Increased tremors caused her fall while she was doing gardening. So that was the thing happened. So that's why we are just telling the nursing home manager that if it is possible, kindly arrange a physiotherapy program to improve her mobility or impaired balance. Like that we are just writing it. And the last final important thing is, like as I mentioned to you all earlier, that she loves gardening, and also she's specifically mentioning to the community nurse, I'm ready to go to the nursing home unless otherwise I have to contact with I have to access with my gardening. So thereby this all accepted by all the family and GP. So that has to be specifically mentioned in our discharge advice, like kindly or make sure her gardening access, like make sure that that she has access with the gardening. So that is very important thing, because she loves gardening like anything. So these all are the informations that we need to write it. And also patient is not transferring today. Patient will be transferred after 10 days, which means 18th of Jan 2022. And then as usual, please contact me for further details. Here, if they have given in a name in the address, you are just writing it yours sincerely, or else you are completing the letter with yours faithfully. So the letter was so simple, and it is a common transferring letter, just we are writing to a nursing home manager, because this year most of the letters were writing a letter to a GP or writing a letter to the nursing home manager, isn't it? I hope you all have done in a good way. Anyhow, hope for the best result. And the last thing is, like as I mentioned, like the speaking topics. So speaking topics, the first topic is superficial burn. So what the superficial burn, which means a young lady came up with the problem of superficial burn. She's worrying about the treatment and scarring, and what all the precautionary options that can be taken to prevent the scarring. So these are her doubts, and we are just clear. And also she's specifically mentioning to the community nurse, I'm ready to go to the nursing home unless otherwise I have to contact with I have to access with my gardening. So thereby this all accepted by all the family and GP. So that has to be specifically mentioned in our discharge advice, like kindly or make sure her gardening access, like make sure that that she has access with the gardening. So that is very important thing, because she loves gardening like anything. So these all are the informations that we need to write it. And also patient is not transferring today. Patient will be transferred after 10 days, which means 18th of Jan 2022. And then as usual, please contact me for further details. Here, if they have given in a name in the address, you are just writing it yours sincerely, or else you are completing the letter with yours faithfully. So the letter was so simple, and it is a common transferring letter, just we are writing to a nursing home manager, because this year most of the letters were writing a letter to a GP or writing a letter to the nursing home manager, isn't it? I hope you all have done in a good way. Anyhow, hope for the best result. And the last thing is, like as I mentioned, like the speaking topics. So speaking topics, the first topic is superficial burn. So what the superficial burn, which means a young lady coming with the came up with the problem of superficial burn. She's worrying about the treatment and scarring, and what all the precautionary options that can be taken to prevent the scarring. So these are her doubts, and we are just explaining her the treatment option, the managements. Okay. And second thing is like bedwetting. As usual, the mother is talking to a nurse, or talking to a nurse regarding her son's problem, that who is having bedwetting issues. So that she's talking like how the way I can prevent this. So the nurse is telling of what, try to avoid drinking before go to the bed, lots of water, and provide him 2 hours before bedtime itself, provide a warm milk, and avoiding of drinking lots of water, and also like tell him to call you whenever he wants to go to the toilet. So and then make set an alarm, like in that time that he can go, as per the alarming that patient the baby can go to the toilet, or practicing him like that. So these are the way we are just explaining the mother how to control the bedwetting of the baby. Okay. And the third topic is asthma. As usual, regarding asthma, like explaining about the possibility of getting asthma, like it is environmental factors and hereditary, and then triggering factors we are explaining, and how to manage, and what is the treatment options, like example inhaler techniques. So these are the points we are just explaining in the asthma. And then the last topic was heparin. So as usual, how the way we used to administer the heparin, as usual, it is a subcutaneous, isn't it? So heparin, as usual, how the way we are administering the insulin, the same steps that we are following for the heparin also. And there are 3 places to administer, and like upper part of the outer arm, upper thigh, and around the umbilicus area. So it's like a subcutaneous in a 90-degree angle. After the administration, should not like rub that area, like that safely we have to discard the needle. So these are and what is the importance of it is a blood thinners, right? So these are the explanations that we are giving to the patients. So overall, the exam was quite okay compared to listening and reading. The speaking and writing were good. So anyhow, still the same. Our fingers are crossed, and hope for the best. And whomever wants to join in our class, our number has given in our description. You can contact us. We have online classes only. So we have 40 days, 50 days, 60 days, and 30 days mock batches, and crash courses are available. Who is willing to join in our class, you can contact us. Okay. So until then,